In this video, we will talk about the region of thigh. The thigh is the region of the lower limb that is approximately between the hip and knee joints. Anteriorly, it is separated from the abdominal wall by the inguinal ligament. Posteriorly, it is separated from the gluteal region by the gluteal fold superficially, and by the inferior margins of the gluteus maximus and quadratus femoris on deeper planes. Structures enter and leave the top of the thigh by three routes. Posteriorly, the thigh is continuous with the gluteal region, and the major structure passing between the two regions is the sciatic nerve. Anteriorly, the thigh communicates with the abdominal cavity through the aperture between the inguinal ligament and pelvic bone. The significant structures passing through this aperture are the iliopsoas and pectineus muscles, the femoral nerve, artery and vein, and lymphatic vessels. Medially, structures, including the obturator nerve and associated vessels, pass through the obturator canal through the thigh and pelvic cavity. The region of the thigh is divided up into compartments. Here you can see the cross-section of the thigh. It has three compartments: anterior compartment, posterior compartment, and medial compartment. If we look at this more simplified diagram, you can see that the thigh is divided into three compartments by fascia. The fascia, more commonly called the intermuscular septum between the posterior aspect of the femur and the fascia lata, is the thick layer of deep fascia that surrounds or invests the thigh. The anterior compartment of the thigh contains muscles that mainly extend the leg at the knee joint. The posterior compartment of the thigh contains muscles that mainly extend the thigh at the hip joint and flex the leg at the knee joint. The medial compartment of the thigh consists of muscles that mainly adduct the thigh at the hip joint. The nerve innervation of the muscles of the three compartments is also different. The sciatic nerve innervates muscles in the posterior compartment of the thigh. The femoral nerve innervates muscles in the anterior compartment of the thigh, and the obturator nerve innervates most muscles in the medial compartment of the thigh. As for the arteriovenous supply, the major artery, vein, and lymphatic channels enter the thigh anterior to the pelvic bone and pass through the femoral triangle. The femur is the bony core of the thigh. It is the largest bone in the body and a weight-bearing bone of the lower limb. The osteology of the femur has already been covered in a previous lecture on the bones of the lower limb. In the coming sections, we will discuss the fascial layers and the cutaneous nerves and vessels of this region, so stay tuned.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.